So our department has been working on a number of things, most of which have been COVID related, unfortunately. But fortunately, we've been able to manage and continue providing services and programs to seniors and older adults, children and families. One of the things that I'd like to point out is the move of the Garvey Senior Activity Center staff to the new Garvey Senior Activity Center. So the completion of the building occurred in April of 2020, and the activity staff and the meals, the home delivered meals and the congregate meal staff moved to the new location. The co-location is with the Leonardtown Library, so we share a building with them. So staff was excited to move to the new building. However, with the senior activity centers being closed by order of the governor of the state of Maryland, we weren't able to initiate programs and services through the centers. So we were planning throughout the year what we could do to help keep the seniors engaged, and we did that by providing remote and virtual programming, activities, exercise classes, information sessions, and other videos to help keep the seniors engaged. So we managed to do that. And it has become very popular to the point that with the senior activity centers being reopened now, we plan to continue providing virtual, remote classes, recorded classes that are available on YouTube and other formats. So we're excited about doing that, and we're going to continue doing that even though the senior activity centers have reopened. In addition to that, we've planned our meals program accordingly. So we were providing home delivered meals only, with the centers being closed. We were not providing meals in the center, so congregate meals were not being provided. But we're talking about ramping that up again. So between last year and this year, we've been planning for the reopening of the congregate meals program, and we're not there yet, but we're working on it. We are initiating the daily delivery of the home delivered meals. So during the height of the pandemic, because of course we're still in a pandemic, we were delivering a 5-pack of meals to older adults who qualify for the meals. So we're phasing in the delivery, the daily delivery, 5 days a week of the meals to seniors who qualify. And we'll do it in stages according to senior activity centers. So of the 3 centers, we started with Northern, and we'll do that for a month, and then we'll phase in the next center, and then again the 3rd center. So we're looking forward to reinitiating that. We have also been working with our Home and Community-Based Services Division, and that division, one of the major focuses is providing coordinating services to individuals who would qualify for a nursing home level of care, but enabling them to remain in their own home. So staff members have been diligently working with those consumers to plan the support that they need to help them stay in their home. That, of course, hasn't changed with the pandemic, but we've continued to do that mostly with staff teleworking, and they've been very efficient and effective doing that. The biggest difference is we have not been going into the individuals' homes to do the assessments and the reassessments. We're talking about working on a plan to reinitiate that when it's necessary and how we will do that. So staff and I are looking forward to when we can do that safely. In addition to the Home and Community-Based Services Division, we have outreach that we do to let the community know that we're here, what we do, and how we do it. And a number of our major events did not happen last year, but this year, thankfully, we're working on a plan to reinitiate them. So over the course of, from last summer to this summer, we've had virtual programming. We've done a few events that were held outside, like a shred event, medication take-back event for those medications that have expired. People don't want them anymore. Along with the help of the sheriff's office, we've been able to collect those. Unwanted documents that needed to be shredded, we've held that event a couple of times, an outdoor event, safely held. Individuals pull up, and someone would retrieve their documents from their car, their vehicle, and then safely shred them. So we're gearing up to some of the other events that we've had and held over the years, such as Law Enforcement Appreciation Day. LEA Day, as it's known, has been taking place not necessarily virtually, but the event that we held last year was a one-day event held in the Commissioner's Meeting Room, and we honored the honorees with social distancing, and it was very well done. This year we chose to do a video series, so focusing on the honorees, and every week there were one or two honorees that we focused on, and we gave the background of their work and the good work that they do. Our fiscal status, we have received a significant amount of grant funds, COVID-related CARES funding, Families First to help support our meals program, and other programs as well. We were fortunate to get funds to help support not only the seniors with their meals, which would be the home delivery meals program, but also to help support some of the local businesses. So in an effort to help keep some of the restaurants going in the community, we had funds that we were allowed to use to help support restaurants and caterers. And so we used that money for the purpose of providing an additional meal to seniors. So we've contracted with 4 providers, and they provide what their specialty meals are. And they were delivered every Wednesday, so it was a freshly prepared meal that was delivered in the middle of the week, something different from the 5-pack that the seniors were receiving. And it was very well received, and we were really happy to help support the local businesses as well. So for our department, we received quite a bit of grant funds from different state agencies to the tune of over $5 million, which with those grant funds, it has made us the 2nd largest department in county government, moving from the 3rd largest to the 2nd largest. So managing the additional grant funds along with the other state and federal and county funds that we manage to provide services and programs to the community, it's been a large undertaking for us, but happy that we were able to provide additional support to the community. The Information and Assistance Division continued by providing Medicare information as well as other benefits, education, and consultation to seniors. So staff have continued to reach out over the course of the last year to seniors, continued to do that. The Senior Rides program, which provides transportation to older adults to doctor's appointments and errands. Drivers are volunteer-based. We were not able to have that over the course of the last year, but we're gearing up again for in the coming months to start providing the Senior Rides program. So we're looking forward to that. The Human Services Division has been instrumental in getting grant funds from the Department of Housing and Community Development to help support individuals in the county with their rental assistance, as well as homeless individuals to eliminate or reduce homelessness in the county. It's been very successful, and the most recent award that we have received is over $4 million. So that, in addition to other funds, has put us in a good position to help people in the community. That, as well as other things that we have continued over the course of the year, the Teen Court program, which we can boast that St. Mary's County was the first to go virtual with the Teen Court program, helping young people stay on track if they have gotten in trouble, and a way to help wipe the slate clean. So we have volunteers who have been committed to doing that, and staff who have been really focused on doing that, and having a virtual mechanism to continue that program has been wonderful. So the Retired and Senior Volunteer Program, even though we did not have a lot of opportunity for the volunteers to contribute over the course of the year, we did have a number of groups who were able to continue, one of which is the group of women who started making face masks for the community. and they were able to hand make or sew over 5,000 face masks, and they donated them to the community. We collected them, staff collected them, and distributed them, and they continue to do that because there's still a need and a request for them. And they have been distributed to a number of organizations in different locations in the county. So that's a huge effort. It's a large number of masks from just a handful of women who have been devoted to making a contribution to the community, and they should be applauded for that. And in addition to that, RSVP has just been staying on top of what they can do for other members of the community. So card making project has been underway. Individuals, volunteers have been hand making cards, and then the cards are collected and sent to different people, organizations in the community. So that's another thing that we're very proud of. So with the senior activity centers being closed, we had staff members who, in addition to contacting the seniors that we come in contact with, wanting to make sure they had someone to talk to and see if their needs were being met, if there were any issues or challenges that we could assist with. So in addition to doing that, we had the opportunity to work with the health department to help coordinate the registration process for the vaccines when they became available. So my staff took the bull by the horns, so to speak, and had very committed staff to making return phone calls, because we know that it was very important for seniors to hear back from someone. And not only that, but to help them get registered. Not all of them had the capability or the technology to register on their own. So IT set up a hotline, sort of, an extension just for us, for our department, to receive calls from seniors. As well, they set up an email address specific for seniors so that we could help register, because you had to have an email address to register for the vaccine. So those who did not have an email address, if they wanted us to register them, we did. And we had handled over 4,700 calls over the course of several months. And registrations, at least for the first vaccine, we had over 4,000 registrations that we assisted with. So that's another thing that we're very proud of, being able to say that we assisted the community in getting their vaccine registrations completed and the vaccines. So over the coming months, what we are planning to do and what we look forward to doing is to resume some of the things that we have not been able to do, in-person activities and events. So I mentioned that the senior activity centers have reopened, so we're looking forward to ramping up our activities for the seniors and programming for the seniors. We have a very nice pickleball court outside of the new Garvey Senior Activity Center, so looking forward to having people enjoy the pickleball courts and having them use the facilities, not just at the new Garvey Center, but the Northern Senior Activity Center and the Loeffler Senior Activity Center. All three of them provide a multitude and a variety of programs and services and activities for the senior adults. But in addition to the centers, we're looking forward to doing a lot more outreach and re-engaging the community programs that we have. The health fair is one that we're planning for the month of October, and we're looking forward to inviting some of the community. It won't be as large of an event as we've had in the past, but it's something that we're looking forward to re-engaging. We're also planning a Veterans Resource Day later this year, which would be in person, smaller, yet an opportunity for us to engage people in person, one-on-one. And just in general for the department, we're looking forward to just becoming innovative in how we serve people and ways that we can enhance their lives and their quality of life, and looking forward to being available as we always have been.